afternoon, everybody. It is a great pleasure to join you today for this presentation as part of the Pituitary Awareness Month. My name is Dr. Sofia Llahana. I am a postdoctoral clinical lecturer for the National Institute for Health and Care Research and a senior lecturer in advanced clinical practice at City University of London. I was a consultant nurse in endocrinology at University College Hospital in London until 2019, where I continue to work clinically on an honorary contract. Thank you for inviting me to talk about self-management needs of patients with adrenal insufficiency and to present some of the findings from our ongoing research project, in which the Pituitary Foundation is one of our collaborators. Firstly, let's briefly talk about what is adrenal insufficiency. Adrenal insufficiency is a condition which results either from damage to the adrenal glands. This can be autoimmune, such as Addison's disease, genetic, such as congenital adrenal hyperplasia, or trauma or injury. It can also result from damage to the pituitary function, which controls the adrenal glands. This can be due to a pituitary tumor, brain tumor, trauma, or what we call idiopathic of unknown cause or congenital born with. The adrenal glands produce a hormone which is vital to life, which is called cortisol. So patients with adrenal insufficiency are not producing the sufficient amount of cortisol that is required for the body to be able to function. Therefore, most patients will require lifelong replacement treatment in the form of primarily hydrocortisone tablets 2 or 3 times a day. Patients are at risk of an adrenal crisis when the body does not have sufficient cortisol levels to cope with a physical or emotional stress. Adrenal insufficiency has a significant impact on the patients, but also the health service. We know from published evidence that 1 in 6 to 12 patients are hospitalized every year from an adrenal crisis, which can be potentially preventable with the right management. Similarly, 1 in 200 patients are estimated to die from an adrenal crisis, also potentially preventable. Patients with adrenal insufficiency also have impaired quality of life and high prevalence of unemployment. There are about 20,000 patients with adrenal insufficiency living in the UK. However, these are the patients with damage to, as I said, either the pituitary or the adrenal function. The bigger picture, however, is that we have almost 500,000 patients on corticosteroid treatment who are at risk of adrenal crisis. So these patients will take very high doses of corticosteroid for other conditions such as arthritis, asthma, COPD, and are at risk of adrenal crisis because of adrenal suppression. How is adrenal insufficiency managed? Daily replacement with glucocorticoids. As mentioned, this is normally in the form of hydrocortisone tablets 2 or 3 times a day, and mineralocorticoids for the primary adrenal insufficiency, such as Addison's disease. Patients require the adjustment of glucocorticoid dose during physical and emotional illness to prevent potential adrenal crisis. Prevention and management of adrenal crisis is crucial and requires immediate hydrocortisone injection, either intramuscular or intravenous. So self-management is crucial for patients with adrenal insufficiency. To manage the daily intake of the treatment, adjusting the dose of hydrocortisone or glucocorticoids accordingly for sick days, but also to prevent the potentially fatal acute episodes of adrenal crisis. So what is self-management? It is the taking of responsibility for one's own behavior and well-being. When we talk about adrenal insufficiency, the self-management for patients with adrenal insufficiency involves behaviors that improve adherence to daily glucocorticoids to minimize adverse effects from over or under replacement. So over replacement leads to side effects and potential complications, and under replacement, impaired quality of life and risk of adrenal crisis. Behaviors that support appropriate adjustment to glucocorticoid tablets during illness and major emotional stress, and behaviors that will aid the immediate administration of hydrocortisone to prevent or treat an adrenal crisis. So, based on the fact that self-management is very crucial, our research study looked at exploring what are the barriers and enablers to self-management in patients with adrenal insufficiency. So this is a phase 1 of an ongoing research project, and we used focus group interviews with adult patients with adrenal insufficiency and family members. So in this presentation, I will talk about the findings from the 10 focus groups with patients from the UK and 4 groups from USA and Canada, conducted in early 2022. So the data were collected via Zoom group discussions, which were recorded and transcribed for data analysis. And how we analyze the data. So this is a depiction of a behavior change model, which is called the COMBI behavior change model. And what it tells us is that for a behavior to occur, in this case, self-management, a person has to have the relevant motivation, the relevant capability, and the opportunity that can make the behavior possible. This can be patient-based, but also external and service level factors. So the behavior is not isolated only on the patient behaviors. On a more granular representation of the behavior, there are many domains combined and developed from many behavior change theories, which are called the theoretical domains framework, and that presents a more granular representation of the behaviors. So in the capability, for example, you have the psychological capability and includes the knowledge, the memory, decision processes, the physical capability, the skills and abilities that a person requires to perform a behavior. Opportunities are patient-based, but also external. So this could be the environmental context and resources that are required to aid a person to perform a certain behavior, but also social influences and the social opportunities. Motivation is also really important, and this involves beliefs about capabilities, beliefs about consequences of enacting a behavior or taking a specific treatment, but also the emotions and reinforcements, incentives that support a person to undertake a specific behavior. So this theoretical model was used to analyze the data that we collected from the focus group discussions. I will present some brief findings and most significant findings around the COMBI theoretical framework. So capability, the most frequent factors that we found that affect behavior are skills and knowledge. So overall, patients reported good level of skills and knowledge of their condition and treatment, which helped them with the self-management behavior for their adrenal insufficiency. So bearing in mind, of course, that these patients were invited from the Pituitary Foundation and the Addison's disease self-help group, patient advocacy groups, and there is a slight bias into that these are the motivated people that are quite aware of their condition and knowledgeable of their condition. But the main point that everybody mentioned was how they had to become their own experts. One of them said, we've educated themselves. I know my body and how and when I need the tablets, when to increase. So yes, I'm on my own expert now. Motivation focused primarily on beliefs about capabilities. So how much patients had confidence in undertaking self-management behaviors, in managing their adrenal insufficiency, in adjusting their medication during sick days and preventing an adrenal crisis, but also beliefs about consequences. So what may happen if I increase the dose of my hydrocortisone during sick days? Could that potentially lead to complications? So one patient said, I go to the GP and they will say, oh, you've got a virus. Okay. And I'll say, I'll up my steroids. You don't need to do that. Steroids are dangerous. So if I listen to him, I end up in hospital. So this is a belief about consequence, but also a social influence in that the patient has developed an expertise and they are very confident and capable of managing their condition. Another barrier that the patients mentioned was the potential inability of advocating for themselves when they are unwell in emergency situations, such as admission to an accident emergency unit. One of them mentioned, the adrenal crisis worries me due to being unable to advocate for myself when I'm sleeping away, believing that no one would have noticed, just assuming that I was having a nap, but slipping into a coma. In terms of opportunities, the resources, environmental resources that were provided to patients formed both barriers and enablers to self-management. Information resources, such as those provided by the endocrine clinic, but also the patient advocacy groups, formed the most significant enablers to self-management. Most patients had accessed information from the Pituitary Foundation and the Addison's disease self-help group. So one of them said, primarily it's the ADSHG that I've used to get all my research and sort of my knowledge as to what Addison's is. Another one said, my endocrinologist just basically gave me a leaflet and said, this is what you have and you need to research it. Other patients mentioned the fact that they had a very helpful and knowledgeable endocrinologist, had a significant and positive impact on their self-management. One of them said, my endocrinologist is brilliant. He spent hours with me. I now have a care plan. He supported me to get to know my body. I've been out of hospital for almost 6 months. And this person mentioned that before that, she had hospital admissions at least every 6 weeks due to an adrenal crisis. Supporting resources, were also reported in terms of the tools that patients use to help them with medication intake, such as alarm reminders, box pills, the medical alert cards, keeping a diary and writing the symptoms and how to adjust the treatment. One of them, for example, said, I have a diary which I write in every day, my medication and what I'm taking. I also have an Apple Watch and set reminders, and when it goes off, it's tablet time, no matter what I do. So this supported the patients to stick to a discipline of taking medication and ensuring that they have a good cortisol level. Lack of awareness in the healthcare professionals and the public was identified as one of the biggest barriers to management of adrenal insufficiency. So patients mentioned that primarily non-endocrine healthcare professionals had very limited knowledge of the adrenal insufficiency, and they found the interaction with these clinicians very frustrating, but also at times it significantly had a negative impact on their management of their adrenal insufficiency. So one of them, for example, said, the medics took away my meds and an emergency injection, and I was told I had to wait for my scheduled meds. So this patient was on a hospital ward and was not allowed to take his hydrocortisone at a scheduled time. Another patient admitted in accident emergency reported that my mom repeatedly asked for my drugs to be administered. The nurse responded, I'll help if you speak to me nicely. I was becoming more and more drowsy and slipping into adrenal crisis. Luckily, when the ward doctor was finally called, she immediately realized that something was very wrong and injected me with hydrocortisone. Similarly, another significant barrier that was identified in this study to self-management was the hydrocortisone injection. The complexity of using a needle and syringe was reported by patients as being one of the main barriers for them to be unable to treat an adrenal crisis in a timely manner. Similarly, many patients reported that the needle and syringe device came with a stigma, as many of them had negative feedback of carrying an injection kit. One participant said, I was stopped and told you can't go in there with needles. So this is an entrance to a music festival. And no matter how hard I was trying to explain that this is a life-saving drug, they wouldn't have it. I was humiliated in front of hundreds of people. Another participant said, whilst traveling through the airport, they specifically questioned her about her hydrocortisone device, but they did not question the other medication she was carrying with her for fertility and growth hormone injections. The complexity of the device was also illustrated in this comment. It's just such a nightmare. It's in such a sort of inaccessible form, and the education for the condition is hard enough, let alone having to treat it in an emergency situation. And many people said, why in this day and age have we not got an EpiPen or an adrenal crisis? EpiPen type device. So this was a brief overview of the findings from the qualitative study in phase 1. We are now in phase 2 of the research study, where we developed a questionnaire to reflect the findings from the literature review, but also the findings from the qualitative focus group discussions. And we plan an international online survey, but also with the option for hard copies for the questionnaire, with the objective to identify and measure barriers and enablers to self-management in patients with adrenal insufficiency. So by collecting more evidence, we hope to provide that needed added evidence to the barriers and enablers to self-management. The patients will be recruited from patients advocacy groups such as the Pituitary Foundation and endocrine clinics throughout the UK. We need every response from patients with adrenal insufficiency, so please look out for the survey link, which will be announced next month. And as a thank you, £1 will be donated to the Pituitary Foundation and the Addison's Disease Self-Help Group for every completed questionnaire. What's next? The final purpose of the study is to develop a digital behavior change intervention to support patients with adrenal insufficiency. So this work is funded by the National Institute for Health and Care Research, and it aims to develop an individualized and interactive platform that will support patients with their self-management. So this is in no way planning to replace face-to-face or the Pituitary Foundation resources, but it's a personalized and individualized platform that each patient can use to develop a self-management plan and program specifically for their needs. And they can work with their clinician to make informed decisions about their treatment and management of their condition. So this work will complete in December 2024, and I would like to thank at this point the patients and family members who took part in this study. The members of the patient advisory group have been extremely helpful in providing feedback to develop and revise the protocol for this study. My mentors and co-investigators, Professors Stanton Newman, Kathleen Mulligan, Shashi Hirani, Stephanie Baldeweg, Ashley Grossman, Christine Norton, and Stephanie Wilson. Big thank you also to the members of the patient advisory group, Pat McBride and Vic Smith, and collaborators, the Pituitary Foundation and the Addison's Disease Help Group. As I mentioned, the study is funded by the National Institute for Health and Care Research. Available further resources you can find from the Pituitary Foundation in pituitary.org.uk. As a volunteer for the Endocrine Nurse Helpline, I would strongly encourage you to access this exceptionally useful resource offered by the Pituitary Foundation. Thank you for listening. Please do contact me if you have any questions on this email.
Thank you so much for that presentation, which was just fantastic and really insightful. We've got a little bit of time and I've got some questions that I want to ask you. But before we get into those, can you just take us back to how you got into this area of work that you are in now, into your role, but also into this area of interest?
Yes, thank you, Ren, and it's been a real pleasure to present my work and in this really important awareness month, and obviously to be working with the Pituitary Foundation. So I've been an endocrine nurse for 16 years, and pituitary conditions has been one of my main areas of interest, both clinical and research. We see patients in clinic probably once every 6 months or once a year. And what I realized is that they come with so many questions, and the time that we have in clinic is quite limited. So we really need to support patients to develop those self-management strategies where they can adjust their treatment or support their management of the condition for the rest of the year. Obviously, the Pituitary Foundation has been exceptionally helpful in that, because we refer patients to the resources you provide, and it's nice to complement that working collaboration. So we need you, and the patients need you.
Fantastic. That's really, it's really heartening knowing that patient, really practical patient needs are at the heart of all of this, which obviously shows through in everything that you're doing. As you were doing the work, what strategies and resources did patients report as helpful for their self-management in particular? I'm sure lots were.
I have to say there is a little bit of a bias in the patients that participated in the focus group discussions, because they were all members of the Pituitary Foundation and the Addison's disease self-help group. So this is the group of patients that are very aware of their condition, of their treatment. They are very well informed. So the strategies that they reported and they talked about were more what they did in the process of learning about their condition, what they found helpful, and what other patients with adrenal insufficiency can learn from it. So the main strategy that they reported was to become your own expert. Again, as I mentioned, as a clinician, we will see the patient every 6 months for 30 minutes. They have to live with that condition for the rest of the year, for the rest of their life. So obviously becoming their own expert and being aware of how to manage their condition is the primary strategy that they adopted to stay well and live with their condition, rather than having to adapt their life to their condition. One of the probably barriers, but also enablers and strategies, was to develop that communication with their endocrine team and their GP, and go prepared to their consultations with questions on this is how well or not well I have been since last time I saw you. What can we do together as a clinician and the patient to make sure that my treatment meets my individual needs, that my life is managed so that the condition fits within my life rather than the other way around.
I think that's really key, isn't it? And being your own expert is not always easy, especially when you're living with a condition, but it's building up that knowledge over time, so that you're a kind of equal partner in your management.
Absolutely, yes. And we see patients as our partners, as you rightly said. So it's about making that informed decision. So as a clinician, I will present the patient with different options for their treatment, for their management. But at the end of the day, we need to make sure that what options we present and what treatment we prescribe really fits the individual needs of that patient.
Yeah, of course, because everyone is so different. On a slightly different note, you mentioned that patients reported that their experience with the ambulance services when having an adrenal crisis has improved significantly in the recent years, which is fantastic. Why do you think that is?
Yes, and it's really interesting. So what we found in the focus group discussions contradicts what has been published in the literature so far, which is really nice to see that things are changing in the UK. From what patients reported, but also the work that has been done, the primary reason for that is firstly the work that the Pituitary Foundation and the Addison's disease self-help group has done with the ambulance service in raising awareness. And one of them characteristically said that actually it was the paramedic who referred it to the endocrinologist. So they said, this is an adrenal crisis, and I really strongly advise you to go and see your GP to refer you to an endocrinologist. So that's, again, this is really positive, because we are seeing the hard work paying off and the awareness of the ambulance service being really good. The most recent development, obviously, is the steroid emergency card, which was introduced by the Society for Endocrinology, and the Pituitary Foundation and the Addison's Disease Health Group. And many patients said that since the card was introduced, as soon as they did show the card, the ambulance service and the paramedics knew what to do. But that was also mentioned for the acute care services. So again, it's really nice and really positive to see that there is an awareness, which was mentioned as the biggest barrier. So not being aware of the adrenal insufficiency and the adrenal crisis did lead to many patients ending up in hospitalizations, and some of them in critical care.
It's really fantastic to hear. And interestingly, we've actually got another session on as Awareness Month. I'm cross-promoting
Yes.
around ambulance care and response times, which is really insightful. And it's actually shifting away from the red flagging, but into much clearer processes and procedures for an adrenal crisis. And we're having really positive dialogue about that. But it's great to hear that there is an impact on the ground as well.
Yes, and you know, recalling the times when we started that work, it's really nice to see the outcome of it.
Yes, and likewise the emergency card, which really has been rolled out through the pandemic, which is quite incredible to have done that and navigated a pandemic. And that's really getting more and more traction, which is great.
Yes, and the good thing with the card is that it does have the QR code, so the healthcare professional can actually really get the guidance and the instructions what to do if somebody presents with an adrenal crisis.
And if anyone doesn't have a card, they can ask their endocrine team for one. They can come to the Pituitary Foundation, GPs, pharmacists. Everyone should be able to supply them with a card. Yes,
absolutely. Or even print it from the website. It's available everywhere, and some patients actually had it on the screen of their phone, which is easily accessible again.
Yeah, brilliant. Thank you. Just going back to your work, what we've talked about the what people found helpful for their self-management. What were some of the big barriers to self-management that patients were reporting?
Just a little bit of background. Before we started this project, I completed a systematic review looking at what are the barriers that have been published so far. And just to, what we found was that the barriers are not just patient-based. So we can't really say that the self-management is only patient-led. So this is patient-based, service-led, but also external factors. So and this is what we wanted to look at, is what are the factors that are influencing the self-management, and how we can then support the patient with behavioral strategies that can improve their self-management to influence both their behaviors as a patient-led, but also external factors. And one of the things we found was, as I said earlier, lack of awareness from healthcare professionals. So this was mentioned over and over from many participants, that they have to deal with healthcare professionals that are not familiar with the adrenal insufficiency. They don't know about it. Some of the patients mentioned that the GPs or the hospital staff were trying to take them off the hydrocortisone because steroids are bad for you. And it was the expert knowledge of the patient and that determination that I know my condition, I know my treatment, this is not right. So again, what we need to do in a self-management program is to develop those strategies for the patient to be able to stand up for themselves and become their own experts, but at the same time raising awareness and improving knowledge. Because the matter of fact is that we will never be able to educate every single healthcare professional to become an expert in adrenal insufficiency. So it's how we work with the system and the patient.
Yeah, which is a longer job, isn't it? But realistically, the meaningful way to go. There is kind of away from barriers reported by patients. You've talked about the hydrocortisone injection device being a barrier in preventing adrenal crisis. What is the solution to that in your mind?
Yes, that was another interesting finding, actually. That the patients said that it was impossible to give yourself an injection when you're having an adrenal crisis. And not just for the patients, but also for the family members or the public members. You can't expect someone, even if you are willing to help a patient on an adrenal crisis, you can't expect a member of the public or a family member to be able to mix and change the needle, withdraw the medication, change another needle. So it is too complicated. So I think it's the time now where we really need to work on a simpler device for hydrocortisone. And I know there's a lot of work going on in that, but with the evidence we have so far, and in the era we live and the development for medication and treatments, to hear the patient say why we don't have an EpiPen, it's quite sad, because it is, again, you can't really, if you are if your blood pressure is very low, if you're very unwell, you can't be expected to mix the medication and inject, and that can potentially save a lot of lives. And there were many patients who reported that actually, because I couldn't manage to give my injection, I ended up in accident emergency and being admitted.
Yes, absolutely. And as you said, there is definitely work that's underway in this area, which is really exciting because it does seem extraordinary that it hasn't been addressed in 2022. And it's a really fundamental area. And Addison's Disease Self-Help Group are obviously also keenly invested in this area and looking at
Yes. And in the next step, when we launch the international survey, one of the questions we are going to ask is how many patients managed to prevent an adrenal crisis because they could self-inject.
That's really interesting. Well, I look forward to hearing that. I'm sorry to bring up the pandemic, but do you think the pandemic has had an effect on these conversations around self-management? Do you think it's brought it forward and made it more urgent, or not?
I think it's the way we are working because of the pandemic. So we couldn't really contemplate a video consultation before the pandemic. So now it's become very acceptable and very common, and patients really like it.
Yeah.
Because they don't have to travel for 2 or 3 hours to come for a 30-minute consultation. And it's that accessibility and finding the information much easier. So that helps with self-management. So the fact that you can access the information anywhere, anytime. And again, as I said in my presentation, what we are trying to do in this project is to develop an individualized a platform where people can access the information, they can improve their knowledge and their self-management, and actually use that 30 minutes they have with their endocrinologist, with the endocrinaires, whether this is face-to-face or online, very effectively and efficiently. So yes, absolutely. I mean, the times where we used to bring patients on site for patient education sessions, I think this is long gone. It obviously online won't replace the face-to-face contact.
Having the options, isn't it? And having both, people can pick and choose.
Absolutely, yes. So complementing that face-to-face support with remote access is really important.
Yeah, that's really interesting.
And the other, sorry to interrupt you, the other important factor post-pandemic has been that, in a way, people have been forced to find the information, so become more exploring where they can identify the information. And there were a number of actually patients that said they came across the Pituitary Foundation because of the pandemic, because they didn't have that contact with their endocrinologist, and they had to find alternative ways of getting that help.
Yes.
And that's really important.
I think that's really interesting, isn't it? It's got to be seen as a silver lining. There's got to be a silver lining in it all somewhere.
Yes, absolutely.
The last question that I've got is what can we as the foundation and our members or just patients do to support the clinical community and their, rolling out self-management? How can we be most helpful as patients or the foundation?
As I said earlier, we complement each other's work. So it's really important to strengthen that relationship. So when the patient comes to clinic, we will refer them to the Pituitary Foundation for the resources, for the evidence-based material. And the foundation works very closely with clinicians and the medical committee. So the patient can be reassured that what information they access will be reliable and evidence-based. And it's the endocrine nurse help has been reported as very helpful to provide patients with the support they need when they need it. And again, it's just strengthening that collaboration. So we complement each other's work. We are not, the Pituitary Foundation is not going to replace the clinicians. It's not going to replace a self-management program, but having that package for the patient is really important.
Yeah, thank you. That's really helpful. Thank you so much for your time today. It's been really insightful and wonderful, and I hope everyone's enjoyed it and got a lot from it. There are other events as part of our Pituitary Awareness Month, which I encourage you all to have a look at. You can find out our information and resources on our website at www.pituitary.org.uk. And we've also got, as Sofia said, the nurse helpline and the information helpline, which are free to everybody, members or not members. So please do visit the website and you can see when their opening hours are as well. Thank you very much.
Thank you, Ren, and good luck with the rest of the Awareness Month.
Thank you.
Thank you, everybody.